What's up guys, welcome back to another video. It's your boy Vimal Thomas and today we'll be studying a very important topic in pharmacology, and that is pharmacodynamics. What is pharmacodynamics? So we can divide this term into two, pharmaco and dynamics. So what does pharmaco means and what does dynamics means? Pharmaco means drug. So pharmaco means drug and dynamic means change. So in simple words we can tell that pharmacodynamics is a drug induced change in the body. It's known as pharmacodynamics. More specifically speaking, the drug which acts on target and gives us effect is known as pharmacodynamics. This drug acting on target, acts on target and gives us effect. This action of drug on target can be measured by a quantity or a particular term known as affinity. And this target gives us effect. This particular effect can be measured by a term known as efficacy. What is affinity? Affinity is the tendency of a drug to bind to a target. And what is efficacy? Efficacy is the maximum clinical effect. So affinity, it is a tendency of a drug to bind to a target, and efficacy is the maximum clinical effect. So guys, this affinity and efficacy can be measured by a simple term known as potency. So affinity and efficacy can be measured by a term known as potency. So what is potency? It is the relative dose of a drug which is used to produce a particular effect. So relative dose of a drug used to produce a particular effect. So potency, it is the relative dose of a drug used to produce a particular effect. This seems hard, but I'll explain you with an example. So let's consider drug A and drug B. 10 mg of drug A and 5 mg of drug B. So the function of these drugs are to reduce the blood sugar level or blood pressure level. Let's consider it blood pressure level. Okay, so 10 mg of this drug A and drug B can reduce pressure or BP by 20 mm per Hg. So 10 mg of drug can reduce blood pressure by 20 mm per Hg, and 5 mg of drug B can reduce blood pressure by 20 mm per Hg. So which drug is more potent? Obviously drug B is more potent because it requires only less dose. Only 5 mg of the drug is required to reduce 20 mm per Hg, whereas drug A it requires 10 mg to reduce 20 mm per hg. So drug B is more potent. So as dose increases, the potency decreases. As dose increases, the potency decreases. Next important topic is dose response curve. So dose response curve are of two types. There is a quantile dose response curve and there is graded dose response curve. So if you're drawing a graph, and let's take this is the response and this is the log dose. So if we draw a perpendicular from 50% of the population responding, we get a dose at which response seen in 50% of population. This dose that is required to produce effect or response in 50% of population is known as ED50. Next we will be studying about the drug receptor interactions. There are 4 different interactions. So first one is full agonist, partial agonist, antagonist and inverse agonist. So what is full agonist? Drug binds to a target and produce maximum clinical effect. It is known as full agonist. Maximum effect. What is partial agonist? Drug binds to a target and produce submaximal effect or not full effect, partial effect. It produce submaximal effect. What is antagonist? Drug binds to a target and produces no effect. That is known as antagonist. Produces no effect. Now the last one is inverse agonist. Drug binds to target and produces opposite effect. That is known as inverse agonist. So opposite effect. So full agonist is maximum effect, partial agonist submaximal effect, antagonist no effect, and inverse agonist opposite effect.